Yes, hi. This is Dr. Shaher Khan. So I've just done an end block on the right and also on the left on a nice, pleasant lady. So set of implants from 1991. So 29 years old. We have an MRI that shows there is an intra and also an extra-capsular rupture. And this is being shown on the MRI and clearly on the left side and clinically. The patient is showing signs of what is rupture and discomfort, chest pain, amongst the many others. So what I was able to do is, you can see, I always like to go ahead and complete end block the patient's initials, the date, and as you can see, look at, this is the implant. I'm going to go ahead and now open it for the first time, if you will. So this is a complete end block, the right and the left. And so I'm going to go ahead and cut it, and so we'll see what the status of this is now. If you can see, there's some outpouchings over here, some indentations, whatnot else, very close, and so we will see it has all the signs and symptoms of what is a rupture. And I was able to get this end block. As you can see, I'm dissecting off, and again, this is all ruptured. Very classic, very typical. All contained. The patient has no drains. This was all contained, and you can see this is the shell. This is all disintegrated. The shell is inside. As you can see, different color. It has a wall to it, and the silicone leaked out. It's like liquid jelly, if you will. All of it contained here. No spillage inside the chest from 29 years old, and no abnormal pathology, all within the system. Very abnormal, very thick, and again, very consistent with implants that are that old. So what I'm going to do next is I'm going to go ahead and, likewise as you saw earlier, I'm going to go ahead and enter from here, and again, all contained, no need for drains. Patients from the Midwest, and so all of this is, I'm going to go ahead and spill this, all ruptured but all contained. Again, just like on the right, this shell, as you can see, is more preserved. This shell was disintegrated. Look at this. This implant is overall still, despite the rupture, the shell is contained, or containing the gist of the silicone, but certainly a rupture. It's also, if you will see, more of a yellowy, oxidized appearance. All contained, all done in en bloc fashion, which is the gold standard, and no other better way of doing it. I took my time to dissect, and we delayed the second surgery just so that we could do it in a very nicely, timely fashion. En bloc, the gold standard. I did cultures from the right chest, left side as well, and the capsules are going to go to pathology. The implant is going to be returned to the patient, and I anticipate the patient is going to do very well, a very good, quick, expedited recovery. Just, if you can only imagine, if this was not done in the en bloc fashion and there was spillage of this inside the chest, what the patient will be going through, not only next week but next month, the next year, the next 5 years, 10 years, and potentially for the rest of her life, because this would be floating within the chest. Hopefully you found this informative. This is Dr. Khan from Khan Plastic Surgery Academy. Please share. Thank you very much.